All right, we're talking about how to fix lower back pain with exercise. So a lot of us guys deal with lower back pain, right? And this comes from daily habits, old injuries, just kind of like the way that life is in 2022. We put a lot of stress on our backs and we don't really do anything to fix it. So that leads to a lot of problems that can be easily avoided. In fact, we had a client here at Pathway. His name was Derek, and he was in a car accident which led to a lot of lower back pain. And sometimes that happens a lot with guys, is that there's like a catalyst, right? Something happens where now this back pain shows up and I don't know what to do about it. And Derek was doing everything. He had a lot of like massages and he was going to chiropractors and he kept trying to solve this problem. He was like working out, but nothing was fixing the pain, right? So he goes to the doctor and the doctor's like, look, I think the best thing for you is spinal fusion surgery, which should be the last thing any of us want to do, right? Fusing the spine is not good. Typically leads to like more problems down the line, like more fusions. And Derek knew that and he was like, look, I'm not doing spinal fusion surgery. So he came, talked to us, and he worked with Jonathan here at Pathway. And Jonathan like took him through really basic movement patterns and just kind of saw how his body was functioning. He was like, look, man, I think the first thing we want to do here is just address our core. So he just had him activate his core a little bit, do a few simple stretches, and with 1 week, Derek's back pain was gone. Crazy. Definitely doesn't happen to everybody, right? But a lot of times, there's really simple things that we can do to help our lower back that we're just not doing. Because if you're driving a lot or you're sitting at an office desk, then what you're doing is you're putting your back in this uncomfortable position, right? This position that's just like not natural for humans, like how we're supposed to be functioning. So the way that your body works is what's called a kinetic chain, right? So one muscle is connected to the other muscle, which is how we move, right? Flexion and stretching. So when you flex one muscle, the other muscle has to stretch to accommodate for the space in that chain. So when we sit, what we're doing is our hips get tight, right? Because when we're in this seated position, so that muscle gets shorter. So the opposite muscle is your glutes, and they get stretched out. And now what's the next muscle in line for your glutes? Glutes are connected to the lower back, right? So when the glutes get stretched, the lower back accommodates by shortening. So we have a tight lower back. That's why when you're sitting all day, you get that lower back pain, you're trying to move to loosen that thing up, right? Now again, I'm simplifying this a lot to make it really understandable. But the point here is you got to keep your body in balance to make sure that things are working together, right? So like in Derek's case, his lower back was in a lot of pain because his core wasn't doing any work. So his lower back had to accommodate for what he was doing throughout the day. He's a mechanic, so he's like constantly bending over, constantly picking things up, and he wasn't using his core to do that. He was using his lower back. So it's putting all this extra stress on his back, which was causing the pain in the first place. So when you can get the supporting muscles to do the job, like activating your core, and you can balance out your overactive and underactive muscles to get things to work in line, then your body's going to be performing better and you can fix a lot of that lower back pain. That's why it's so important that guys can't skip leg day, because when your glutes are loose, what a problem to have, right? To be like, man, my back is just killing me. Like, what's wrong? I got loose glutes. You can't be walking around with loose glutes out here, right? We got to tighten those things up. So by activating our underactive muscles that get stretched out from just being in seated positions all day, and stretching out our overactive muscles, like doing simple lower back stretches and things like that, we get things back in better balance and our body can feel a lot better. Now, if you have some kind of previous injury, absolutely consult a physician about that, right? Herniated discs, back issues are super common, but a lot of times we use those as reasons why we can't exercise, when the best thing for it is exercise. There's a saying, my wife is a physical therapist, and it's one of my favorite sayings, but she says, motion is lotion. I think the best example of this is to look at like how far knee surgeries have come. Back in like 30 years ago, if you saw somebody have like a ACL tear, like they blew out their knee or something, like a sports athlete, they had that like the giant cast on and the legs up, and they're not moving for months, right? Now, in a lot of cases, what they have people doing when they have ACL blowouts is they're having them doing like assisted walking within a week, because they know that the best thing for that is to get moving through that muscle, to get moving through the injury, to help that thing recover, right? To get blood flow into it and help it getting back to its working order versus just like being held up all the time, right? So if you got injuries or issues with your lower back, consult with a physician. If they're like, yeah, you're good to go, you gotta get back in the game, get stretching, get activated, get your body back in balance, and you can fix so many of the knee issues, the lower back issues, the shoulder issues that are keeping you from exercising or are giving you like daily aches and pains. So much that can be solved with some simple exercise strategies. Just gotta work to get that body back in balance.